Blog Talk on ExtraordinaryLifeChiropractic.com. Today I want to take a minute to talk about diabetes and exactly what diabetes is. By definition, diabetes is chronic high blood sugar. And what we mean by blood sugar is blood glucose. Glucose is a complex carbohydrate that we eat. When we eat, our blood glucose levels raise, and it triggers a mechanism in our body that causes the pancreas to create insulin. That insulin goes into the bloodstream and allows that glucose to move from the bloodstream into our cells so that they can create energy. Well, this is the key factor in diabetes. Either the pancreas isn't making enough insulin, or not making any at all, or the receptors on the cells are not allowing the glucose to go into the cells. But any of these factors will cause the glucose levels to raise in the body, and that's how we get chronic high blood glucose levels. What I want to do with this blog is hit four main categories of diabetes. I want to talk about the types of diabetes, the causes, the signs and symptoms, and the treatments of diabetes. So to start, I want to talk about the types. We have three main types. Type 1, which is insulin-dependent diabetes, and we also hear it called juvenile diabetes because babies can get diagnosed with it and people before the age of 20. And type 2 is non-insulin dependent diabetes, or we also hear it called adult onset diabetes. And we hear it called this because it has a slow progression, and we usually see people past their 20s and on up in years getting diagnosed with this one. And the third one is gestational diabetes. We see this with pregnant women. It's intolerance to glucose during pregnancy, and that's why it's called gestational diabetes. As I move on to the causes of diabetes, I want to point out some of the preventable measures that we can put into our lives to assure that we don't get diabetes ourselves. With type 1 diabetes, we have no evidence that shows exactly what causes it, but there's some evidence that shows that viruses or autoimmune diseases cause it. And if we can build up our immune systems and keep it healthy, then we've lowered the risk of us ever getting type 1 diabetes. With type 2 diabetes, we see it caused by low activity levels or not exercising, being overweight, especially around the waist area, and poor eating habits. Obviously, if you look at this is highly preventable. As long as we just add some activity to our daily lives and watch our eating habits and our weight, then you've extremely lowered your risk of getting it. With gestational diabetes, we see it with overweight females while they're pregnant or before they're pregnant, with unexplained miscarriages and recurrent infections. Again, if we can just add a little activity to our life and watch our diets and make sure that we're not overweight, we can prevent this type, or to boost our immune system with it as well so that we make sure that we don't have recurrent infections or infections at all. This will highly lower our risk of getting gestational diabetes. If you've ever been around a person with diabetes, I'm sure you've seen some of the signs and symptoms of it, or maybe you're familiar with some yourself. But what I want to do right now is go through some of the signs and symptoms of it so that you can look at your life, your health, and the health of the people around you to see if maybe they need to get checked out to see if they have diabetes. There are some signs and symptoms that are common to all types of diabetes, and those are increased thirst, increased appetite, frequent urination, and fatigue. Now with type 1 diabetes, you may see this. You may see weight loss despite an increased appetite, nausea and vomiting, absence menstruation, or abdominal pain. And with type 2, you have blurred vision, erectile dysfunction, frequent or slow healing of infections. And with gestational, you may see blurred vision as well, nausea or vomiting, frequent infection in the bladder and skin, or weight loss despite increased appetite. So these are all things that you should look for in your life to see if maybe you have some of the signs and symptoms of diabetes and you should go get checked out. So now I want to go over some of the treatments for diabetes, but I don't really want to call them treatments. I want to talk preventative measures. I've hit on education a little, and I know that if we educate ourselves on diabetes and any disease, that we're at less risk of getting it. But with diabetes in particular, exercise. If we just add a little exercise into our daily lives, then we've lowered our risk that much of getting diabetes. And meal planning. If we just plan our meals out and watch what we eat, lower our intake of sugars or complex carbohydrates, then you've lowered your risk of getting diabetes. And with type 1 diabetes, if your pancreas isn't making any insulin at all, then you'll have to have insulin injections or an insulin pump. And the number one way to prevent diabetes is by taking care of your nervous system. And the way that we do this is through chiropractic care. God put an amazing healing power in our bodies. And it's through the nervous system that He controls everything that we do and everything that we are. And it was so important that He put a spinal column to protect it. And in that spinal column is the spinal cord. And it goes throughout all these nerves here to all the organs and the systems of your body. And if you can keep it healthy and keep it this spine aligned so there's no pressures on your nervous system, then you've done a lot on combating any disorder, and especially diabetes. So in concluding this blog talk, I want to hit the main points I was wanting you to cross. That if we adjust our lifestyles and keep our nervous system healthy, then we're on the fast track to preventing any type of disease. So thanks for joining us here on ExtraordinaryLifeChiropractic.com, where life change happens.